Hi, I'm John, your host and advocate for the Sacred Plant, and I'd like to introduce you to Corinne Malanca, co-founder of United Patients Group, and my wife. So thank you for being here today.
Good to be here.
And thank you for joining us today, and thank you for watching the Sacred Plant Healing Secrets Exposed docuseries. What we're going to cover tonight is over 2,000 questions we've received with the docuseries. So we're going to try to chip away as many as we possibly can. But before we begin, please know we cannot legally answer any direct medical questions. So let's go into our first question. This question comes up all the time, and even with this docuseries, when all the questions that people have submitted, this was probably the number one question, so I thought it'd be great to start off with that. If I live in a cannabis illegal state, how do I get access? And Corinne, if you'd like to start with that.
That's the million-dollar question. Being in a cannabis illegal state, or even limited state, it might be CBD only, creates a lot of challenges for families and patients. Some are left to take desperate measures and illegal measures to obtain this medicine, and whether they relocate, whether they have enough time to write their congressman and have a few years to try to change the environment in their current state. But for those that cannot wait, like we couldn't wait with my father who had weeks to live, we needed medicine right away. So, and it's the case for so many. These people are relocating, leaving their entire loved ones behind. They're uprooting their children, changing school districts and states. It's quite sad to see what's going on with these families, and they desperately want to go home, but they've found wonderful treatment in cannabis legal states, and they know if they return to their home state, they will not have that medicine again. So it's a real challenging decision that nobody should have to make when their loved one's life is at stake.
Yeah, and these families are called, there's a term for it, cannabis refugee.
Yep.
Leaving their state, going to a legal state to obtain this medicine safely. A lot of families that we talk to on a regular basis and have it as well as written in, many of them are forced to do this illegally, and it's a shame that some families who do get a second chance at life, like my father-in-law and Corinne's father, he just happened to live in a legal state. And as mentioned before, cannabis was not our lifestyle. We asked for it because we truly believe that this sacred plant could help them. So it's a challenging question, as you know, and there really isn't a great answer to that. A lot of families, are, as you mentioned, are forced to make some big decisions in their life to have safe access to this sacred plant. So, moving on to the next question: is cannabis a one-size-fits-all? Can you answer that?
Great question, and it actually pertains also to the previous question, where when people are in cannabis illegal states and they're trying to obtain medicine, what they don't know is what formulation they should be taking per their condition. It's not a one-size-fits-all. In people who are ill, end of life, palliative care, what have you, really need to do a full patient intake with a medical professional who is well-versed in cannabis as a medicine. Their dosing, the formulation, the potency are vital in treating their disease. You could have two patients with lung cancer, stage 4 lung cancer, and same age, and their protocols could be different based on their medical history, based on their medications that they're taking, drug-to-drug interactions. It's very important to go over this. My father had a heart arrhythmia, so his formulation was dictated by avoiding racing his heart. We didn't want to give him any type of cannabis medicine that may race his heart. But then again, another lung cancer patient may not have a heart arrhythmia. They might have diabetes. They might have low blood pressure. All of these things really need to be taken into consideration. Back to the cannabis illegal states, the people that are there, another risk that they take is not being able to see lab-tested medications. They're getting what they can illegally, but most of the time they don't know what is in that medicine. They don't know the formulation. They're not advised on how often to take it. It may be the incorrect formulation for their condition, and it's an extreme challenge. So it's best, and we highly recommend having a full patient intake with a medical professional. We have a registry where people can search for medical professionals who do have that background. Again, they're in cannabis legal states, but it's very important to go through the entire patient history before choosing a formulation and dosing that works for that condition and that patient specifically.
Gotcha. And you mentioned, Corinne, that it's not, well, the question was, is it a one-size-fits-all? And you do see a lot of, we get this question quite a bit,
We do.
About take as much as you possibly can, blast it out, a gram a day. Can you touch up on that?
Yeah, many on the internet do suggest ramping up quite a bit to a gram a day. Some people we've heard even
Or
taking...
even start with a gram a day.
Yeah, it's a slippery slope. We do know that there is a therapeutic window where if you treat with too low of a dose, you might not see a result. But then if you have too high of a result, you might reduce positive results. So there is a therapeutic window. A gram a day, we're finding, and many researchers are finding, that is not needed in most cases. So it's very important to, when a patient is starting off with cannabis, definitely the patient intake, understand what you're taking and how you should be taking it, but also knowing that there are, you can move up in small increments. If you can get a treatment like my father did with a minute dose of cannabis oil or tincture, what's the point in spending so much money on a gram a day? Can get quite expensive when your body can respond to a more homeopathic approach. So we see that most physicians and researchers are leaning towards the microdosing. Microdosing is extremely important. This is what we did with my father. He took a minute fraction of a gram. They speak of grams in rice grain sizes of drops of this cannabis oil, and a gram of this oil could be about 16 rice grains. But my father's drop of oil before bed was the size of a sesame seed only before bed. That was it. He never ramped up from there. So it's important to know that microdosing is the best approach initially. There are very few cancers that do need quite a bit of dosage, but it's on the rarer side, usually a glioblastoma. So I think it's really important to research microdosing and not run into that heavy-handed thing. As you always say, are we talking about a 300-pound linebacker, or are we talking about a 12-year-old? It depends.
Or even a 2-year-old.
Or a 2-year-old, or, So yeah, it matters.
And coming off the question of is a one-size-fits-all, here's one that we get quite a bit as well, is the only way to consume medical cannabis via smoking?
No, you don't have to smoke it. Specifically to disease, you're looking at whether it's capsules, tinctures, oils, topicals, transdermal patches, nasal sprays, sublingual sprays. It runs the gamut. Smoking, no. Vaporization is utilized for extreme pain situations where somebody needs immediate pain relief. So there is vaporization. There have been children where they've had an atomizer type system for a child who's going through a seizure. So,
which we saw in the docuseries.
Yes, we saw that in the docuseries, and most of the time it's usually tinctures and oils and sprays, usually.
And a lot of these oils and tinctures and sprays come in different formulations too. So do you want to touch up on the different formulations as well? I know, again, it's not a one-size-fits-all. You did talk about that, but
yeah, that goes back to that question where it's again really important to have your full patient intake to know which formulation to buy. It's not suggested by any means to go to any company and randomly choose a product. You could also end up wasting a lot of money realizing that one's too potent or one didn't work enough, and having to buy additional products. We've heard this before. We had that one person that came to us that had just
18 different
18
products.
different products that somebody recommended for them. 18 different products, and that is not needed. So
Overkill.
way overkill. We err on less is more. Proceed with caution. Start low, go slow.
And ask questions. I mean,
Yeah.
I know you're asking us questions, but do not be afraid to ask questions. Ask questions. Has the product been tested if you have
Yes,
access
look at the
to
test results. Ask for recommendations from people you know who have had success. Those are good options, but making sure that you have a medical professional explaining to you what you need to buy. And don't rely on the bud tenders at dispensaries to diagnose you and tell you which product is best for your condition, because they haven't done their intake on all your other medications or supplements that you may be taking, or your medical history of diabetes and what have you.
Here's another question here is, how much CBD should I take for my cancer?
Great question. Actually, there's something that makes me think about the people who we hear from say CBD a lot, or they say CBDs. I need CBDs, which is confusing because CBD is cannabidiol, one molecule. So what we find is people are using the term CBDs as total cannabinoids, as medicine, when it's actually numerous cannabinoids. THC, THCA, CBG, CBN. There's many. Again, how much should one take for their cancer? What cancer is it? What is your medical background? What medications are you on? Number one. But number two, CBD for cancer is a subpar approach. You need all cannabinoids working in concert with each other to best address cancer in general. When you start using one molecule specific, the efficiency drops a bit. And so it's very important to know that you need all the cannabinoids in specific formulation per your condition, based on the medical intake, and go from there. But to address it with CBD only, you would be doing yourself an injustice.
And which leads us into the next question too. I want the good part of the cannabis plant. I don't want to get high.
Yeah.
And
Well, we hear that, and we hear, we heard on a radio talk show, we won't say the name, but it was a sports radio talk show, right?
Yep.
And they were describing CBD as the medicinal side of the plant, and THC the side of the plant that gets you high, which couldn't be further from the truth. In terms of specifics, they are both medical.
So do you want to touch up on that? What THC has been proven to do?
Yes, THC kills cancer cells by way of signaling apoptosis, which is considered self-induced suicide by a cancer cell. CBD arrests the spread of cancer, has wonderful anti-inflammatory effects. I mean, we could go on and on about what they each do, but they all play a role in working together to treat disease, all diseases, not just cancer, autoimmune conditions, arthritis. Well, that is autoimmune. There's numerous conditions, Alzheimer's and neurodegenerative diseases and spasticity, and you need all the cannabinoids in different formulations. And it doesn't necessarily mean you have to be high. I mean, we hear many researchers and physicians talk about, as you creep up and you start very low and you creep up, as soon as you start to feel a slight psychoactive effect, then you drop back a little bit, and then you know that that's your zone. That's where you stay right there. You don't need to blast yourself and not be able to navigate your typical day.
And I know a lot of you are going through cancer or illness right now yourself, which leads us into the next question here is, I'm going through chemotherapy. Will cannabis disrupt my treatment?
Many people that we speak to, they're late stage in their disease, and they always say, or many times they say, I'm going to try this, I'll do what my doctor says, and then maybe I'll circle back, but I'm not ready to do cannabis yet. And they think they have to choose one or the other, which they do not. Cannabis in the proper formulation and dosing works wonderfully well with chemotherapy and conventional treatment. There was a study that came out recently, I'd say in the past month, specifically stating how this is and why this is. But no one has to wait. You don't have to choose one over the other. A lot of people have felt this way. They aren't willing to go alternative in replacement of conventional medicine, but they work very, very well together. We've had friends of our own who tell their doctors at UCSF, well, I'm doing cannabis treatment as well, and they say, great, continue to do it. And not only does it help them get through chemo and radiation without having to get on numerous pharmaceuticals for all the side effects, but it also helps in the healing and treatment of that disease. So I think it's very important to stress that, in my opinion, they should be used complementary in synergy with each other to have the best outcome for that patient.
Well, I know this next question is near and dear to Corinne. Can we take this plant as a preventative measure so we hopefully don't get a disease or cancer?
Great question. I addressed that quite a few years ago, and the short answer is yes. The red flag is I don't believe in any given cannabis legal state that preventative is on a qualifying condition list, although it should be. Inflammation in general is one of the main sources of all disease, and if we could treat inflammation, that would be help. It would help quite a bit in preventing other diseases, conditions. Women like myself with my aging body and many, many changes that include inflammation, lack of sleep, slight anxiety. I think it's very important. CBD and THCA, among others, are very important to work on inflammation in our bodies. They're non-psychoactive. There's many other things that can be added to these tinctures that are healthy in terms of essential oils, but they are not on qualifying condition lists. So that's the kicker.
That's the kicker.
That's the
and
kicker.
Coming from Corinne, not only is she my wife and I live with her, I know, but her background, cannabis was not your background.
Oh my goodness.
So,
no.
I mean, I think they would like to hear this. A lot of people think that everyone in California has been using cannabis for forever. Cannabis wasn't our lifestyle before my father-in-law got ill.
Yes, so choosing cannabis as a preventative for myself was a big leap. I am extremely straight-laced and don't partake in anything mind-altering at all, and never have. But once I had gotten into this research, working with my father and John and building our company, I couldn't deny the science anymore. And I was probably the most staunch against cannabis that you might run into. And I'm happy to say I'm completely on the other side. All it takes is reading the science, which there is plenty of science. So don't let anybody try to tell you that there's no science. There is an enormous amount of research in science. So I do take it preventatively and also to treat, my issues of my age-related changes.
But not smoking?
No smoking. Yeah, this never is about smoking. It's tinctures that I do. Mm-hmm. And I think it's really important for all of us. And it takes reading the science. And I understand that so many people are so against this as a medicine, cannabis as a medicine. They think it's only a stoner topic. But if you take some time to read a small bit of science, we're happy to provide anything anybody needs. But you would be quite surprised and make that shift like I have to understanding the medical applications of this sacred plant.
Here's another question that we get quite a bit. I have a job that requires periodic drug testing. If I were to take cannabis oil, would it show up on a drug test?
Yes, if you're taking cannabis oil, it will show up on a drug test. Absolutely. There are other ways that people take cannabis where we have heard yeses and nos of whether it shows up in a drug test. For instance, topicals, the creams. There are some reports that if somebody had a cut on their hand and they were rubbing cannabis oil in lotion form into their knuckles for arthritis, that it showed up on a drug test. So you have to be extremely cautious. Definitely cannabis oil will show up in your bloodstream, or tinctures or sublingual sprays. And I think it's very important to be extremely cautious about that when taking cannabis.
Here's another great question. Is it possible that this plant can be all good?
Very good question. Cannabis as a medicine, taken properly, works wonderfully well. We always see some type of improvement in every person. Sometimes it's just better sleep, less depression if they're going through a grave illness. We see them have hope, ambition, making plans to take a trip. But not all survive using cannabis treatment, even combined with chemotherapy. Not all survive. But from what we've seen, all patients do see an improvement in their life. Cannabis as a medicine is something that brings the body back into homeostasis, into balance. So it's working on all your systems to bring balance. And gosh, how do you explain that even further? I mean, it's just an all-encompassing positive for the body in general. So we feel it's a positive. When you relate it to survival rates, that's a different story. But it does help everyone on some level. So we have seen, and a lot of reports have.
And we've seen a lot of families, it's a stressful time and at end of life. I've experienced it. But we've seen that it's brought families together. They've been able to talk. They've been able to see the patient, their loved one, more at peace.
They don't have to pass on morphine. They can avoid the heavy painkillers and in turn avoid, dare I say, the horrible constipation that painkillers bring on, especially with seniors. I mean, we see that quite a bit. And if somebody is going to pass, they're comfortable, they're content, they're not in a morphine coma. It's a positive all the way around, not only for the person passing, but for their loved ones as well, where they can actually enjoy each other's company, reminisce, and cross over on a positive note and a loving note.
Here's another great question. I'm confused, John. I smoked pot in high school, and my grades dropped from straight A's to D's and C's. It is a three-part question, so I'll continue on here. The people I knew, this is my 50-year-old eyes here. The people I knew who continued using pot into their adulthood have obviously impaired cognitive function and no self-motivation for anything other than getting high. And again, as I mentioned, three-part. What is the difference between the cannabis you're sharing about in the sacred plant and the pot my friends and I were using back in the days?
Really, really a great topic. There's a significant difference in what we are talking about here on the sacred plant and what you're referring to, this person, in terms of the recreational use in high school. The recreational use obviously is smoking pot, the dried plant matter, and getting high. And yes, kids have utilized cannabis that way for many years, decades, if not longer. And we agree it slows people down, but that is the recreational side. What we're addressing is strictly dosed meds, strict milligram dosed meds. We're not talking about rolling joints. We're not talking about filling a pipe. We're not talking about randomly using this. This is specific dosing based on a medical professional's protocol. So there are studies. I know Dr. Piamelli out of UC Irvine has done studies on the developing brain, and I had one conversation with him. I asked him about the developing brain and heavy pot smoking as young kids, And he said that the jury is in, that reports state that it does affect the developing brain. So if I want to take it a step further, treating a child for epilepsy or treating a child for cancer, they're not smoking the plant at all. As I said previously, that some of these children have a vapor atomizer system, albuterol type system, that they have the vapor, but it's not smoked or burnt plant matter. So that's different. On that same topic, those children's cognitive functions are severely impaired already from the hundreds of seizures that they have per day, and they're extremely impaired already permanently. So if they use a vaporization system, usually it's an oil, but a few for immediate relief in a horrific seizure will use this albuterol type system, but it's not a regular use. That's emergency situation. So what you're talking about, or this person is talking about in terms of smoking pot in high school, and what we're talking about here is miles apart, separate, two separate subjects. Nobody is smoking weed in the medical realm, and in terms of trying to treat a cancer by smoking a joint. We don't see that, and we don't recommend that. The dosed meds, sublingual oils, tinctures, sprays, sometimes topicals for arthritis is generally what we're speaking about. So, but that's a great question. We get it a lot. Again, myself being a naysayer, until my father got sick, I understand that it looks like the sectors are the same, but they're not. They're separate sectors.
Patients that we worked with over the years too, who have on a pain level of 1 to 10, they're at a 10. Yes. And they do find relief via smoking.
But we recommend vaporization.
Or smoking or vaporization, because they can have instant relief. Smoking goes directly to the pain receptors. An edible, a sublingual tincture, an oil sometimes takes 45 minutes to an hour and a half.
Absolutely.
To get into the system. And so, not to count you out regarding patients smoking it, there are a lot of patients that do find
with extreme pain.
Instant relief via smoking and vaporization.
We just hope that they're vaporizing.
Next question. How do you come up with dosages for treating cancer?
Great question. So dosing is very intricate. There is no graph where you can find certain conditions and go over to the age of a person and know exactly what to give.
Hopefully one day we'll get that way.
Hopefully, yes, hopefully. But I know a lot of people outside this field believe that a lot of us in this industry are holding those cards to our chest, but that's really not the case. What's going on is this is not a synthetic or synthesized medicine. This is a plant. So similar to homeopathic approaches, cannabis is very along that path. We look at echinacea bottles, and it gives you, in general, up to 2 capsules 3 times a day. But in cannabis, it's, again, the full patient intake, drug-to-drug interactions. What is that patient taking? What kind of meds? What kind of supplements? How impaired are they? With my father, again, being wasting and on full-time oxygen, had we given him a dosage that many follow, which is a heavier-handed dose, he would have slept through the appetite stimulation, and we needed him to eat first. So the main goal for my father was to get him to eat first, and then get him stronger and start treating the disease. So dosing is extremely intricate. The medical history of a patient is vital to coming up with the dosing. So a lot of people, I mean, you could give a general starting point, I guess, and then you would start taking those factors into consideration about the patient. It's challenging working with a plant, but if you look at GW Pharmaceuticals website, I've done this before because we teach a pharmacology course, and wanted to see, based on the frustration of everyone saying, okay, low and slow, how ridiculous is that? That's not a dosing protocol. So I went to GW Pharmaceuticals website to look at their cannabis medicine, which is a sublingual spray. They're out of the UK, and what they recommend for dosing. And if you look that up, you'll see that they say go low and slow. They don't have an exact formulation as well. So I think that paints a pretty good picture of where we are with this medicine, and remembering that it is a plant and that each patient is different. Their gut function is different, how they're going to absorb this medicine. Some people readily absorb it and others do not. And there are so many moving parts to coming up with a dosage per person. We'd love nothing more than to be able to explain to the public exactly how to dose. It's just not that simple, and medical guidance is needed.
Great answer, Corinne. Here's another question that we get quite a bit as well. Will my insurance cover my medicine? You want to touch on that?
Yes. So given the federal status of cannabis, insurance companies are not covering cannabis as medicine, although wasn't there there was an article that came out where somebody filed a lawsuit and an insurance company was ordered to cover this man's medicine. So that was a first. And how many months ago, maybe a few months ago, was that?
Probably about 5-6 months ago. But there are companies that are coming up right now that have been trying to address this. I'm going to say probably for the last 5 years. So hopefully it will come up.
Typically, I'd say, except for this one report that we saw where somebody fought in court and an insurance company was ordered to cover this man's cannabis medicine. Other than that one article that we read, we have not seen insurance cover cannabis yet. But we know that there are large companies working on developing a successful business model for that.
Here's the next question. I've been watching the series regarding specific conditions and diseases, but only vaguely. Can you point me in the direction where I might find more information about these treatments regarding the sacred plant? You want to touch up on that?
Well, we do have a section on our website that addresses conditions specifically. They're in alphabetical order under the patients tab, and you can find your way to whether it's cancer or IBS and click on that. When you open it, you'll see numerous links to studies that have been done in that area with the sacred plant cannabis.
Thank you and God bless.